and a very good day to all of you. My name is Dr. Lahari, and we are starting off your Year 3 lessons with a new topic, Oral Radiology Introduction. The learning outcomes of this topic would be to identify the uses of diagnostic imaging in dentistry and list 6 appropriate properties of X-rays. Next, illustrate the parts of the X-ray machine and uses of each of the parts. Differentiate between conventional film-based radiology and digital radiology. And lastly, explain the guidelines for ordering dental diagnostic imaging based on the American Dental Association recommendation. Just to clarify some terminology, radiology is the branch of medicine concerned with X-rays, radioactive materials, and other ionizing radiations, and the applications of the principles of this science to diagnosis as well as treatment of disease. Radiography, on the other hand, is the technique itself, the technique of producing a photographic image of an opaque specimen by the penetration of radiation such as gamma rays, X-rays, neutrons, or charged particles. Oral and maxillofacial radiology is a specialty of dentistry and a discipline of radiology concerned with the production and interpretation of images and data produced by all modalities of radiant energy that are used for the diagnosis and management of diseases, disorders, and conditions of the oral and maxillofacial region. So what are X-rays? Right, so we've heard of this before, but just to refresh knowledge and start you thinking of what X-rays actually are. So I'm sure all of you remember this picture. This is the electromagnetic spectrum, which we've all learned in school. It shows you various wavelengths of different forms of electromagnetic energy, and somewhere here lie the X-rays. You would also be seeing the visual light spectrum, which is visible in this wavelength here. Right, so all of these different types of energies constitute the electromagnetic spectrum. So let me get to a little bit of history of radiology. Interestingly, the textbooks on radiology these days don't include the part of the history anymore, but it's something which all students and anyone who's interested in radiology must and should know. So that's why I thought I'll include a little bit of history of radiology just before we begin what radiology actually is. So Wilhelm Conrad Röntgen is the father of radiology. He was born in 1848 and died in 1923. Now this man has a lot of importance, and modern day radiology owes a lot to him. That's why he's termed as the father of radiology. He discovered a new form of radiation called the X-rays in 1895. Röntgen, or in German called as Röntgen, was working in his lab at the Physical Institute of the University of Würzburg in Germany, experimenting with the Crookes tube. Now remember that by this time electricity had already been discovered or invented rather, and on the evening of November the 8th, which is called as World or celebrated as a World Radiology Day, even to this date, when he shielded the Crookes tube with heavy black cardboard, he found a greenish fluorescent light that could be seen from a barium platinocyanide screen 9 feet away. And that's when it occurred to him that he had discovered a new form of radiant energy called as the X-rays. Right, so that's a picture of him, which I've taken off from the internet, which shows you the greenish glow on his face. And those were the glass tubes where vacuum would be created and X-rays could be produced by passing electricity between the cathode and the anode. His discovery was presented in a paper dated December 28, 1895, called as On a New Type of X-ray. This led him to win the first Nobel Prize in Physics in 1901. Sadly, Röntgen died at Munich on February 10, 1923 from carcinoma of intestine. Little did he know that the X-rays actually were harmful and had side effects which led to him developing cancer of the intestine. A lot of work has since then been done on X-rays since the discovery was made in 1895, and this is a setup of his room where he was working with X-rays. And this is an example of a Crookes tube, which is a glass tube which had vacuum that could be created with anode and cathode in it. So the first röntgenogram, as it is called, or the first radiograph, was in fact an image of his wife's hand, which showed the shadows thrown by the bones of her hand, and that of a ring that she was wearing, surrounded by the penumbra of the flesh, which was the first röntgenogram ever taken. And because their nature was not known, he gave them the name X-ray. So that's the first ever X-ray taken of Röntgen's wife, and that's the ring, the metal ring there. And this is taken from a science photo library, and there's some more such interesting images there available on that website. So just the funny thing which I generally like to imagine and crack a joke about is, why was she wearing the ring so high up on the ring finger? Anyways, jokes apart, but that's how it was. So but basically, when he was experimenting with the light, he just asked her to put her hand in there, and he was so surprised, taken aback by looking at the image of the bones, but in a very faint penumbra or shadow of her flesh. So as early as February 1896, X-rays were being used clinically on patients, right? And in that very year itself, a New Orleans dentist named Edmund Kells took the first dental X-ray. So that's how the history dates back very, very long ago, and more than 100 years ago. So Edmund Kells, this is a picture of Edmund Kells, and this was a picture of his lab, and that's the dental chair where he was working on with an X-ray machine. Taken about that was a picture taken about 100 years ago. So with the discovery of the X-rays, definitely the glass tube making industry also had more takers, and there was a manufacturing of these glass tubes with vacuum, and people started experimenting with X-rays at their own labs, and which led to a lot of experiments, but a lot of mishaps, as well as a rise in number of X-ray related side effects as well. So moving on, if that was the history part of it, now I'm going to start off talking to you about a little bit of physics in general, and just for you to recollect, probably this is not really related to what we're reading. Somewhere down the line you might want to use these terminology, and that's why I'm talking about them here. So wavelength is the term used to describe the distance between repeating units of a propagating wave of a given frequency, and that's the symbol that you use for a wavelength, which is a lambda. And wavelength is calculated based on velocity over frequency. So actually you don't really need to use these terms in dentistry, but it's important to keep it in mind. Similarly, frequency is a number of cycles per unit per time. It is inversely proportional to the wavelength, and its units are hertz. 1 hertz means that the event repeats once per second. So if you look at these different colored waves here, you will see that the pink one at the bottom has got a higher frequency because it repeats more number of times in this particular wavelength than compared to the red one, which repeats very few times. So just to recollect the structure of an atom, the atom is the smallest unit of an element that retains the chemical properties of that element. We are all familiar with this Niels Bohr the solar system type of a structure of an atom, where at the center you have protons and neutrons, and in the periphery you have the electrons around the center of the atom, and the electrons are negatively charged, the protons are positively charged, and neutrons are neutral. Moving on, that brings us to the properties of the X-rays. Now we've just understood that there are type of electromagnetic radiation. Let's get to understand what these X-rays actually do. So remember, I had just told you that X-rays form a part of the electromagnetic spectrum, which also has other types of radiant energy in it. So X-rays are a type of electromagnetic radiation. They are highly penetrating, they are invisible, and they are electrically neutral. That means they do not carry any charge on their own. They come in a wide variety of wavelengths, and if you're measuring wavelength in Armstrong units, then they can range from 100 Armstrong units to 0.01 Armstrong units, and they come in a variety of energies as well. So you have strong energy X-rays and you have lower energy X-rays. They release very little heat when they pass through matter, and they travel in straight lines. So we use all of these properties to actually help in taking diagnostic X-rays in the in human beings, or even in the field of veterinary. right? So X-ray properties, continuing with it, they travel at the speed of light, which is 3 times 10 to the power of 8 meters per second in vacuum. They can ionize matter, they cause fluorescence of certain crystals, and they cannot be focused by a lens. So they would just pass through the lens. They affect photographic film, and they produce chemical and biological changes in matter by ionizing and excitation. Lastly, they produce secondary and scattered radiation. The uses of imaging in such as such, that means we're talking about X-rays as well as other form of imaging in dentistry. Imaging is performed in dentistry primarily only after history taken in clinical science, and these signs indicate that it can contribute to diagnosis and treatment plan. So the uses of imaging in dentistry would be to primarily reach a diagnosis, to assess the extent of a pathology, that means how big is the disease that is there in the patient. In order to analyze it, you use imaging. Also to plan treatment, how to optimally plan it. I mean, on the X-ray, if you discover that there are other areas to be treated, then you probably, it changes the plan of the treatment. Also, X-rays or imaging in general helps perform certain procedures. And last but not the least, to assess the outcome of the treatment performed. Let's say we've done a root canal treatment and you want to assess how well the treatment has been done. X-ray would be an excellent method of performing or assessing the treatment of that particular case. So this is how the X-ray machine looks like. This is an intraoral X-ray machine, and this is a mobile unit. Sometimes you have wall-mounted units. In fact, the wall-mounted one are more famous. And this is an extraoral X-ray machine. That means this, for example, is the one available in our clinic. It takes panoramic and cephalometric as well as cone beam CT images. So it's actually a 3-in-1 machine. Here, in photography, you still need visible light as your form of energy to take an image. In X-rays, in a radiograph, you use X-rays as a mode of energy to capture this image. I hope you understand what I'm trying to make you understand. But I'm trying to give you an idea that both visible light and X-rays are a form of electromagnetic radiation, or they are both in the electromagnetic spectrum. Just that light is used for taking photographs and X-rays are used for imaging the human body to see radiographs. Right, so moving on, just to still clarify between imaging, film-based and digital radiography in dentistry. In the film-based, sorry for the typo here, you see that there are periapical radiographs, bite wing and occlusal views, all of these taken inside the mouth. That means you can place inside the mouth. And there are extraoral views where the film is placed outside the mouth. These are, for example, panoramic, cephalometric and skull views. So simply the intraoral ones are smaller in size than the extraoral ones. It's just the extent of the area covered. Now these images can also be taken with a digital radiograph, right? They become two-dimensional when you're taking any of these intraoral views, panoramic view or cephalometric view. They can also be done with digital radiology, right? And there's something called as a three-dimensional view, which is virtually non-existing with films. This can only be done with digital imaging. The examples of which are computed tomography, CBCT, MRI, ultrasonography and nuclear imaging. Now all of these is not restricted to using X-rays alone. The MRI uses magnetic resonance, ultrasonography uses ultrasounds and nuclear imaging uses other forms of radiant energy. So CBCT and CT are the ones which use X-rays. So this is just basic to make you understand. We'll discuss all of this in detail in the coming lectures. Again, just to explain to you, an intraoral periapical radiograph. This is how the image looks based, if you're taking it with a film. And this is how it would look on your computer if you're taking it using a digital mode of imaging. So it's virtually the same. The clarity is the same. The area covered is the same. It's just that the mode of imaging is different. These are called as bite wings, which they don't show you the periapex very clearly, but they're used for viewing the proximal aspects and the bone height. Then we have the occlusal views, which are generally to see your arch form, if there is any pathology in the palate. For example, this is the maxillary and this is mandibular. This gray area is the tongue, so that's why you don't see much here. Whereas this is the palate, there is bone here, but then there is a large radiolucency, okay, periapical area in the apex of these teeth, so which has some diagnostic work that needs to be done here. This is an example of a panoramic radiograph where you're seeing the entire arch, maxilla and mandible in a wide view, right? So this is used as a scout film or also as a guide film before you want to, let's say, do a third molar surgery, or you want to place an implant, or you just want to start orthodontics, and it's a very important radiograph. Or of course, if there is trauma and you're suspecting fractures. This is a cephalogram where you're seeing the profile of a patient. In this radiograph, you see one side of the patient overlapping over the other, so it's primarily used for diagnostics in orthodontics. This is an example of a skull view. There are various other skull views, but I've just shown you one. This is a posterior anterior skull view, which is taken for the entire skull, and again of use in maxillofacial surgery. Moving on to the parts of the X-ray machine. Now, like I was telling you, this is an intraoral X-ray machine. That means you use this machine to produce X-rays and to take X-rays or film or to image the teeth primarily. Right? So it has some parts. This is the tube head. This is the power supply, connected to the power supply. Okay, the reason why you have a power supply is first of all to heat filaments and generate electrons, and also to establish a high voltage potential between cathode and anode, which are there inside this X-ray machine. So more when I explain to you in the next few slides. This is an extension arm which can be moved easily, and you have a control panel where you can press buttons to change the amount of radiation that you would like. This is just an example of how the radiographic examination room looks like, right? And of course, it's an older image. Now it looks more like this, right? So there is a lot more emphasis on infection control in radiology room. Not that there was not that it was not there earlier, but now the emphasis is a lot more. So this is just some of our friends, our student friends, who are just posing for us, and that's exactly how you do how it is in the radiology room. This is an image to show you how a radiation is produced. This is the tube head or the X-ray machine head, and the radiation comes out from the X-ray machine, strikes the tooth and hits the film which is inside the mouth, and during the process is a little bit of scattered radiation and secondary radiation also produced. So what's exactly happening inside this tube head? Inside the tube head you have something called as a cathode as well as an anode. Now, the cathode is negatively charged and the anode is positively charged. So you definitely need electricity for producing X-rays. And the cathode has a filament which is made up of a tungsten coil, and it generates electrons. It also has a focusing cup made of molybdenum and creates negative charge and having a concave reflector. The target, which is the anode on the other hand, is also made up of tungsten. Remember, tungsten is a choice of metal here. And why tungsten? Is because it has high atomic number, it has a high melting point, high thermal conductivity and low vapor pressure. Right? So what does this target do? It converts the kinetic energy of the electrons which are coming from the cathode to the anode into X-ray photons. It also has a copper stem which helps in dissipating heat. So all of this is actually inside this over here in the tube head. So what happens actually is when power supply is connected to the cathode being negatively charged and anode being positively charged, it gets heated and there is electrons that are emitted, and then they strike the target and photons are produced. So in fact, this entire glass tube, which is a version of what you had seen earlier, Röntgen's Crookes tube, is now so small. It's just about 5 cm in size, and you have a cathode and an anode which helps in producing X-rays. So more about this when we deal with radiation physics in the coming classes. This is just an example, or this is just a gist of how X-rays are being produced in brief. So now, when you're actually doing radiology with film-based imaging, there are a lot of items or equipment that are used. First, you have the X-ray machine, then you have the lead apron. The patient is made to wear an apron to protect the rest of the body from receiving radiation, and so only the tooth and the face area, the maxillofacial area, receives radiation. There is a dental chair. Then of course you have a viewer, you have film mount, manual processing box, film holders, the ones which help holding the film inside the mouth. You have developers and fixer solution, and you have a metal clip. So all of these are used in routine radiology. Then you also have the equipment used in digital dental imaging, which is again, you still need x-rays. You have the lead apron and dental chair, which you will find common in all of these. It's common to the film based, but in here you have the sensor, which is either example of a CMOS or a CCD sensor, or you have a PSP plate. So we have both of these in our clinic, and we use both of these for taking x-rays. And this is example of a PSP sensor and a scanner, which you need to eventually produce x-rays like this, which you can see on a computer with some imaging software. Right, so that nearly brings me to the end of the chapter, which I'm going to end with some guidelines for prescribing dental diagnostic radiographs. This is based on the recommendations from American Dental Association. When do you generally ask for x-rays for a patient? Is when you have based it on the nature and severity of the abnormality or the disease that you're seeing, you're looking at. You're having a patient in which the disease cannot be assessed fully by physical examination alone. For example, you have, let me give you the simplest example where x-rays are used in dentistry. For example, you have a patient who's come to you with a deep dental caries, and you're trying to assess whether the pulp is involved. Should the patient go in for root canal treatment? Is there a periapical pathology? So that is something which you cannot see convincingly only with clinical examination. You need an x-ray to assess the depth of caries, as well as to understand if there is a pathology at the apex of the tooth, and begin root canal treatment, right? So that's really important when your disease cannot be seen, assessed completely with clinical examination alone, and if the disease is not evident clinically. For example, if the patient is complaining of pain and you're suspecting that there could be a proximal caries and you're not able to see it clinically very clearly, you would need an x-ray to aid you to see the proximal surfaces, which helps you see the extent of disease. Similarly, let's say clinically not evident, another example would be a third molar which is impacted. You're not able to see it clinically, and you would want an x-ray to give you a better understanding of what is the position of the tooth. Also, ability of imaging technique to accurately reveal the characteristic diagnostic features. It gives you accuracy in what you're trying to see. Also, the guidelines for prescribing also determine the amount of imaging detail required. Let's say you're looking at an implant case. You want to perform an implant surgery on a patient. Then a simple intraoral radiograph may not be enough. You might require imaging of a higher order, which lets you see more fine details in the bone. For example, a cone beam CT. Right, and also depends on the radiation dose to the patient. For example, if you have a pregnant lady who needs an x-ray to be taken. Now, in case it's a simple filling to be done, you would probably do it without a radiograph. Or if the patient needs an x-ray and it is important to do a radiograph, then you would switch to a digital mode of imaging and try and schedule it in the second trimester, where the fetal growth has already, organogenesis has already happened. So these are some very important things that need to be kept in mind before you actually prescribe a radiograph for a patient. So that brings me to the end of this chapter. This was just a brief introduction introducing you to what oral radiology is all about. So in the coming chapters, you will come to realize that there's a lot more to radiology, and it's a lot of fun, and there is so much of new learning here. So this is a general symbol of radiation that is used just to caution that there is radiation exposure happening. And these are the textbooks that we would like you to refer to. Either of these versions, the content is nearly the same, and you can contact me if you have any doubts. You can email me. I'd be more than happy to clarify your doubts. So I hope that you have found this chapter useful, this lecture useful, and I hope it has sparked some interest for radiology, and hope to see you all soon. Right, thank you.